be talking about how do you replace hormones today. I'm Dr. 𝐦𝐨𝐬𝐤𝐞. I am an internal medicine doctor here at Angelic Wellness. For those that are new here, welcome. If you've not yet subscribed to this channel, you want to do so right now. You don't want to miss this, okay? What we're going to be talking about today is how to replace hormones and what are the best options, what are the safest options, and we'll also talk about who should and who shouldn't, right? Because that is also very important. And if time permits, I might share with you why I started replacing mine early, okay? Let's go. So, hormone replacement therapy. If you don't know what hormones are, find that video on this channel. But you want to understand what hormones are, why I consider them one of the most powerful chemical messengers in your body, and why you don't want them to dwindle with age, okay? So, let's talk about how to replace them. Think of it this way. There is going to be the natural options and there's going to be the synthetic options, okay? So when we're talking about hormone replacement, people throw that term out generally. They're not very specific what hormone they're talking about, whether they're talking about the synthetic option, whether they're talking about the natural option, and they definitely don't even talk about what route are they talking about. What do I mean by route? Meaning, how do you take that hormone? Meaning, how do you put it in your body? Because that also matters. Okay, so we're going to discuss all that in this video today. So first thing, what do I mean by synthetic hormones? Well, synthetic hormones are hormones that are made in the lab. They are made to look similar to what your natural hormones look like, but there is some distinguishing factor about them. It might be that they look just like the testosterone in your body, but they have this hydroxy group, or it's a hydrogen atom, or something attached to it that makes it different from the hormone that naturally comes out of your own organ. That's what we call synthetic. It was made in the lab. It has something on it that makes it slightly different from your actual natural hormone. On the other hand, I have hormones that we consider natural or bioidentical, which means that if you look at these two structures under the microscope, you're seeing exactly the same thing. You don't know which one came from the ovaries and which one came from the yam or sweet potato, okay? When we say bioidentical, that's usually what we're referring to when we say natural, because it looks just like the ones that come out of your own ovaries. There's no additional hydrogen atom on it or hydroxy group or some structure that makes it different from what exists in nature. Okay, hope that clears it up. So most of the time, the ones that are made by pharmaceutical companies, so that they're able to patent it and make money from it, it has to look different from the one that exists in nature. So it's not that the pharmaceutical company doesn't want to make it exactly identical, but if it's exactly identical, they cannot patent it. You know, the idea of patenting is that something unique about this thing that you've made, right? So they have to make that drug unique so that they can claim it as their own IP and be able to charge a lot of money for it, okay? So that's why the synthetic hormones are not exactly identical. On the other hand, the natural hormones or the bioidentical, because they look exactly like the one in nature, they cannot be patented. So there's no pharmaceutical company that's going to benefit from you using a bioidentical hormone, because they can't go sell it for thousands of dollars. It exists in nature. So that's the difference, okay? And that difference sometimes for some hormones become very, very important. So we're going to use an example of progesterone, okay, which is one of the hormones in the body that women make a lot of progesterone when they're pregnant, because this hormone is the hormone that actually helps promote gestation. You see where the name came from? Progesterone, it promotes gestation, which means that when a woman gets pregnant, this hormone actually helps to the uterus to make sure that she can hold on to that baby, nurture that baby, right? So progesterone usually surges really high during pregnancy. And one of the hormones that we lose as we go into menopause is this progesterone. Some pharmaceutical companies came up with a solution called progestins. And progestins they look just like progesterone, except that they have some additional things attached. Remember, like we just talked about? So they can kind of trick the cell to think that the cell is interacting with progesterone, but that extra thing on it is, after a while, noticeable, okay, by the cell. And what we found is that when there was a clinical trial done back in 2000 called the Women's Health Initiative, there was some findings that suggested that women that took these progestins, okay, not progesterone, they were given progestins, had more incidence of certain cancers and blood clots and different things that was significantly higher than the group that didn't take the progestins, meaning the control group. Right? Because you know, when we do clinical trials, we're comparing the control group that doesn't take the drug to the group that takes the drug that we're testing, right? So when they looked at those two groups, they found that the group that took these synthetic progestins, not progesterone, progestins, had some increased risk of certain problems. And so some of the conclusion from that study then said that maybe we shouldn't give women hormones. But that was a conclusion that was overly generalized, because one of the problems with this study is that they didn't actually look at a third group that they should have included in the study, right? Of women that took the natural progesterone, like the ones that I just talked about, like the one from 𝐜𝐸𝐬, for example. They didn't look at that group. So we looked at the ones that didn't take anything versus the one that took the synthetic one, and then we concluded that women shouldn't be on hormones. And this is one of the reasons why there's a lot of misinformation around this topic, is that this trial, this Women's Health Initiative study, was a huge deal. It enrolled thousands and thousands and thousands of women, and by the time they came up with their conclusion, it was so misleading that a lot of women and doctors immediately stopped taking their hormones altogether. And for decades now, we are fighting to repair some of the information that this study was not very clear about. So when I'm in a consultation room with my patient behind closed doors, I'm explaining this to them. Like, look, if you go look at that study closely, you will realize that the design of it was flawed. Because one, it didn't include a very important group. The group of women that were on the natural options. And it wasn't because this option was not available at this time. Because natural hormones had been used for over 100 years. And there was no reason why it shouldn't have been included in the study. But there was no financial gain to be made by comparing natural hormones to control and then to synthetic, right? So that's one of the issues that we find, that if we're not comparing the right things, we can come to conclusions that is not the best for the general population. So a lot of women have been scared to death about using hormones to help their symptoms. Because look, when they put you on Zoloft and Xanax and Ambien as treatments for your menopausal symptoms, it's not because your body is deficient in those synthetic drugs. what your body is telling you is that it's deficient in hormones. That's why you're having the hot flash. That's why you're having the night sweats. That's why you're having the low energy. That's why you can't sleep. Because you're missing the hormones that do and control these functions. So that's what you want to replace. Not the Zoloft, not the Xanax, not the Ambien. So let's get back to where we need to replace the hormone that the body is telling us it needs. Because what I find in my practice is when I help my patients replace these hormones, they no longer need these drugs. We're able to safely wean them off. Why? Because now their brain is getting the signal that they have enough hormones in the system. Now their brain is hearing that they're producing the estrogen that is needed to keep their bones strong, that is needed to prevent dementia. Now they're getting the progesterone that's helping them sleep. Now they're getting the testosterone that's stopping that night sweat. Testosterone that leads to you taking the sheet on and putting it back on and taking it off and putting it back on all night long, that's disrupting your sleep. When we replace those hormones, all of a sudden your body feels normal again. You feel like yourself. And you're able to move on with your day and get the things that you need to get done and not develop, early Alzheimer's. Okay? So those are kind of the things that you need to understand about replacing your hormones. Okay, hope that has been helpful. We're going to be talking about the different forms in the next video. Different forms, how you actually put those hormones in your body also matters. Okay, so click that subscribe button so you don't miss when I drop that video. Okay, see you next time.